Namaste, Jayant, and welcome to a conversation I've been looking forward to have for a while. He's famed as a healer, someone who totally revolutionized healthcare in Bharat, and it's my pleasure and honor to be able to sit across and speak with Dr. Prathap Reddy ji of Apollo Hospitals.
And thank you, Anand. I'm happy that we are speaking about health of the nation, health of the world. I think everybody needs to live healthy and happy.
So today is about life leadership and of course looking at health. Where do you see Bharat today in healthcare? And if I were to ask you, what do you foresee are going to be our biggest challenges in this field?
I think first we must say over the last 4 decades, from what's called the third world healthcare, today we are global leaders in healthcare. Almost in every single field of health, we are up there. If you look, I'm a cardiologist. I started because there was no acceptable cardiac surgery program in the country, and a few people who can afford, the rich and the powerful, I used to send abroad. Because there was no facility in the country. The medical equipment, import duty was 320%. There is no funding available for medicine. So there was absolutely zero development when the world was adapting newer technologies. So today I'm happy, after 40 years, we are as good as any center anywhere in the world. Talking about cardiology, cardiothoracic I started. Today we have done the world's largest number of cardiac surgeries and all different of surgeries, including minimal robotic cardiac surgeries. And in cardiac interventions, we have done everything including structural heart. So whatever world is doing, we have done. And we have done the largest numbers. And in healthcare, it's not the numbers.
Yeah.
It is the outcomes.
Yeah. Let me ask you something, because you're a cardiologist. Why is it that there are so many youngsters today who are dropping suddenly with a heart attack? I'm sure you have studied this and you've seen this increasing pattern as we see around us.
When I came back from US about in the 70s, I used to see patients early. I still remember a patient from one of the banks. I don't want to mention the name. They come for their checkups. So one of the young recruits, 26-year-old, he joined. He came for a checkup. I found that he had a positive for cardiac. So he went abroad and had his bypass. He's perfect. So I have seen a number of these, and that is what changed. In 79, I had a young man, 38-year-old, who was under my treatment for almost 6 months. But he couldn't get relief. The only savior for him was surgery. So I fixed with Dr. Denton Cooley in October. Unfortunately, he died on November 9th, 1979. You know why? He couldn't afford that $50,000. Although Denton was willing to give 10% discount, he couldn't afford that. And I saw his wife and 2 children and brought back all the young people's memories and said, how many more are going to die because they can't afford this?
Surgery.
Now, getting back to your original question, why young Indians are in 1974, in American cardiology, by that time I saw 2-3 patients. So I saw one patient, I saw his grandson getting a heart attack, and I saw then his father getting a heart attack. The son came before his father. So like this I used to see him. So I told them in there, but one of them said, oh, Indians don't know the date of birth. I said, don't be foolish. They not only don't know the date, they know the star on which they're born. But in 1981, in one of the American cardiologists, they saw 3 people who didn't get up from the duty room. All 3 were Indians. Then hell broke out. Indians get a heart attack. So they did a study in that slum next to London airport. They said they all eat coconut oil. I said, don't be foolish. Keralites not only eat coconut oil, they rub all over the body. They don't have increase in it. Then they blamed ghee. I said, I told my grandma, my mother-in-law, He drinks not teaspoon, tablespoon. She is absolutely healthy. So finally they did a lot of study, and the final of the study was that it was a genetic problem, genetic alteration in South Asians because of a famine which took place a few hundred centuries ago. So I think we're seeing that, we're seeing more of it. This is why we're stressing that they should have an early checkup. I'll come back to it when we talk about prevention, what we can do to make a difference for these young people.
Because I'm asking you, Dr. Saab, because I'm sure you would also see cases like this where there are perfectly healthy people on the face of it who suddenly drop, who suddenly have a cardiac arrest or they have a heart attack and then they drop. In the recent times, we've seen a lady who was going to office, a person who was a lifetime vegetarian, another person who's used to eat all sorts of stuff in the world, a third person who's just walking on the street or playing badminton and suddenly drops. Now, these cases were they always there, or do you feel something's changed in our habit, in our lifestyle that's triggering this?
I think it is there. As I said, young people are getting heart attack. Not too long ago, about 5 weeks ago, one youngster, one of my patients who had a transplant in bypass in Houston, his grandson, he felt uncomfortable in his chest. He didn't know whether it was a chest pain or something, but in the bedroom, he was thinking of something. Then he came to the drawing room, met his wife and other relatives, and said, I'm not feeling too well. I don't know what this is about. You get me some hot water. So he drank hot water, and then they said, what next to do, and dropped dead. And it was a Sunday. And this is why I'm going to announce next month that Apollo will be the first hospital in the world which will never sleep.
Oh, wow.
It will work 365. We will not work 24/7, emergency only. But I want people like this, because he didn't know it was a heart attack. He didn't know it was an emergency. If he knew it was an emergency, we were the first one who had the 4-letter 1066. If you had called 1066, our ambulances are artificial L5. So from the moment you go to the patient, that gets connected to the doctor. And the two people who go there, the driver and the supplier, both are trained people, technologists. So they start the treatment right there, and the doctor directs them. So we could have saved lives with ambulance. So I think what is necessary for us to see, to give this information saying health is first. You must look after your health. We look after everything else, your body, your dress, your eating habits, all of this there. But very few or none at all, a small percentage of people care for saying, am I healthy?
Am I healthy?
I'm not fit. Am I healthy? So this is where I think our future vision for Apollo is to see how can we drive these preventive health checkups.
What drives you, sir? What makes you get up in the bed, get up from the bed every morning and say, I have to do this. I have a purpose.
If they know mine, and if everybody follows what I do, the country and the world will be a healthy one.
So please tell us.
For 45 years, I had blood pressure, I have diabetes, I have inherited both of it, I had a heart attack, I was obese. After 45 years, even after the stroke, I had the heart attack, they put a stent. I'm perfectly normal. I do my normal work, like any other person. 6 days a week I work, and I do my duties regularly. Because I take care of all of these. My blood pressure is 140/70 last night, and my sugars this morning was 92. So I have no stress. I got a lot of work, a lot of challenges. I solve it. Afterwards, I say, I've done my best. And little prayers,
So,
I release me completely. Before I go to bed, I have that prayer, so I get a comfortable sleep.
how
So
can you
that's-
not have stress, sir? You said,
have
I
a
don't
lot
take
of-
stress. How do you not do that?
lot of-
What is the secret? Is there a method to this?
I have a lot of stress because what we have is a continuous challenge of patients coming with different problems
Correct.
and saying, are we doing, have we got everything to make him well? You know, I'll give a small example. About 5 weeks ago, 2 people came from air ambulance on the same day. One from Sweden, one from New South Wales. Both were unconscious. Both were told that there is no chance in them. So I went to the hospital. The relative, the mother of the child came and cried before me. I have to take. I said, we will do our very best. You know. So I spoke to the thing. They were a panel of doctors were looking after them. They were doing their very best. The outcome is, the boy, I met him last Saturday,
Wow.
and he came in a wheelchair, and his mother this time hugged me and cried out of happiness. And that boy has told my secretary, every Saturday afternoon I go there. So he said, I'm going to walk into Dr. Reddy's office and shake hands with him.
How do you, and if it's for this generation and for all of us also as a learning, how do you deal with failure? How do you deal with challenges? If you can explain to us via some incident in your life, how does one deal with, oh, I have a roadblock, I don't know how to get across this, or I want to do this, but I don't know how to do it. What does one do? How does one fail? Or you try something, it doesn't work out. And people brand you a failure. So what do you do? How do you deal with it?
First, I have a good team of people because I don't know administration. I'm a doctor. I don't know administration. But I've selected good people, professionals, to run the hospital. And I'm a cardiologist. But the hospital does everything, as I say, including transplants.
Yeah.
But because I've selected good doctors and given them a good team, given them the technological background, but they perform. But when they have a problem, when I go and tell me a problem, we'll try to collectively see how we can solve the problem.
Yeah.
Because I can't do it myself. Because but if we solve the problem, the MD, what he does, what he or she might say, my daughter, she tells the other hospital, this problem became, we solved it like this, so you should not have the same problem there. So I think it's a continuous process. Whatever you want to call it, our goal for excellence has this blockages. We try to clear it and see that whatever comes in one hospital, if they have solved it, that problem should not occur in another hospital.
So you're saying one is information sharing, two, you say have a good team of people. So the jobs that you can't do, get people who can do that job well, put them in place, and then communicate with each other. An instance when somebody told you...
Same thing, even when a difficult problem comes, we want the doctor to have a panel, 3-4 of them to discuss, so that the best thing is if the patient gets the best possible care.
But as an individual, in your years as you were bringing and building up of the first hospital that you set up of Apollo, there must have been people who said, what are you doing? It's not going to work.
Not only that, in the beginning when I thought of this, I had a successful practice.
Yeah.
Very busy as a cardiologist. When I wanted this to happen, many people, including my own Sambandhi, Mr. Reddy, he said, what are you doing? If you want next door, put up a hospital there. Why are you thinking of all these crazy things? Because none of this was available. Custom duty was 320%. The hospitals were not funded by any institution. And costs are different.
Yeah.
So everything is in Delhi. And Delhi I went first time as a student. Second time I went for this purpose. You can imagine, and fortunately for me, one of the general secretaries, Mr. Mupanar from Iraq, I met him on the plane. So he said, come next to me tomorrow morning, we'll take you for Dharma Darshan. So I went in Dharma Darshan. First day, second day, they said, he's so-and-so. She just passed on. On the fourth day, the RK, the one, he asked, you want to meet her? I said, of course.
Her is Indira Gandhi.
Indira Gandhi. She listened to me for 12 minutes and she was so impressed that something should be done. Immediately she picked up the phone, asked the secretary, Krishna Rao Sahib, you must listen to him and do something about it and do it before this cabinet. So I went to him, he spent more than 2 hours with me, called the Secretary of Health, Secretary of Finance, Secretary Civil Supply, for steel cement, all 4 of them. So I had a meeting with them and they all decided, they recommended, number 1, the custom duty exemption from 320% to 0.
Wow.
And previously, the cement by government was 16%, and on the public it was almost 40 rupees. Steel was the similar. So civil supplies, Prathap C, he granted steel and cement for the first hospital. Like that, but it's not, I'm taking him now in 3 minutes, but I had to make 50 tips.
50 tips.
To see the minister is different. To see the secretary and convince him. Then finally down the line, the undersecretary or, for him, that's where I learnt a little Hindi, But finally, what I am happy, they all understood saying, I'm not asking for myself. I'm asking to translate the health status of the nation. From a third world country, I'm looking saying, my people in India should be able to get the same care that's available anywhere in the world. So this, as I said, some of my friends, even on the day when the president inaugurated, people who were inside, at the end of the function, they said, Dr. Reddy, you are a very clever fellow. You built a beautiful hospital. You're going to turn it into a beautiful 5-star hotel. I said, you're wrong. It's not 5-star. I'm going to make it a 7-star hospital.
Lovely.
For their singular contributions to each one in different fields of health.
Are you a spiritual person? Do you believe in a lot of prayer? Does that help?
I do in the morning. I do my prayers in the evening. And you saw in the room about pictures.
But how does that help? Do you believe every person needs to find their spiritual connect? Does that help you center or, as a professional
whatever you do, people do, yoga, they do meditation. All of these are like prayers, I think my prayers are like yoga and meditation put together. That gives me that type of spirit, clears my mind, thinks, my inner consciousness and spiritual power improves whatever I'm doing. And my day's strain is taken off and gives me the future vision, future thoughts.
But Doctor,
that's whatever yoga meditation, prayers are, are upper thing than meditation and yoga.
But, man of science, person of science and spirituality, they're supposed to be 2 separate paths. How can a person who believes in science and who's a doctor also be spiritual or have deep faith? This is a question often asked. So, how would you answer it?
I don't know. This question is a very simple question to answer. The super person has given you a small sperm, which is what? Microsperm, you can't see. Microsperm, which has made you what you are today. And completely, every day, so many millions of cells are being thrown out and new cells are born. All your system, from the small cell, you developed a body like this, whether it's a female or female. So he has given those. So I have no comparison.
So you believe there is along with the science, there is also a supreme, or there is an element of divinity in creation itself?
No. We're here. This tree is different. Its seed is different, and it brings this. So I think it's all the Creator, whatever name you call him. But there is a creation, because we are actually seeing it.
Yeah.
Whatever you are, before your birth, you are a small microsperm.
So,
and these two join, and from that
the argument, sir, where it comes from is that then why do we need a doctor or a human being to fix a heart, or to fix a valve, or to operate, or to fix a hand, a broken hand? He's created, so let him only fix it. So that's where the contradictions start coming. So how would you answer such,
because he is not there, no? You can't see him. Physically, he is not there with you. So, most of the priests and all that, probably they have less ailments. Because we don't follow the strict discipline of good health. Good diet, good exercise, good mental things. All of these health maintenance 7 guidelines to keep good health. If you keep that, probably you don't need him much.
You don't need the doctor much. Yeah. But maybe there are others who say perhaps God also created doctors so that he can fix all those people who don't follow the right path in terms of keeping good health. But, there's another argument of traditional medicine, or let's say Ayurveda, or forms of medicine versus modern medicine. Do you want to, one tends to talk down the other, talk up the other, there are claims made. What is your understanding? How would you look at modern medicine?
I'll give you a small, first I'll start with saying, today I'm happy it's not Apollo, there are another 300 good hospitals in India. I wrote to our Prime Minister, first I must say I admire the Prime Minister. He's a great Prime Minister. I wrote to him that India today can become global healthcare destination, and I wrote 8 steps how this can happen. And they gave another thing. There's a shortage of 8 million healthcare doctors, nurses, paramedics in the world. Only India can do this. I called it global workforce. And I said I would like to come and explain this to the PAM with my 4 Shaktis. So a letter went to him. The appointment came. And then my wife said, why 4 daughters, why not me? So my secretary called. They said, please send her also. I'll show you the pictures. But anyway, she also came. But he said, I went through the whole thing. I agree completely. Your concept and your 8 steps will follow. But I want to call it as Healed by India, because way back in 750 BC, Sushruta did the first diagnostic, this one, medical treatment. Until 1250 AD, the world came to India for Ayurveda. And I strongly believe in Ayurveda. We have Apollo Ayurvedic Hospital. We have in Delhi, we have here a beautiful one, small one, 31. And in Oncology Hospital, we have, in Bangalore, we have 3 hospitals. But we are concentrating more and more. I strongly believe that there should be an integration of all of these: allopathy, Ayurveda, Unani, homeopathy, all of this, and to see what best the patient can get. Like for example, I have a knee pain. They did a huge surgery and all that. That 50% relief. I called the Ayurvedic people, and my knee is perfect. In 2 days, they put some medicine, the patch and a little massage, and it became absolutely normal. So I think this you should adopt this.
You said you admire Prime Minister Narendra Modi. Why do you admire him?
I admire him because he thinks that India should get back to its old status of being one of the foremost countries, because people are intelligent, people are capable, and they have been deprived of few things. We must give them those. And if we give all of these, they will spring back and make India proud. And his Viksit Bharat 2040 vision is great. And he's not only talking, he's acting. As I told you in my two things, when I told them, he named it Heal India, Heal by India. After we left 1.5 hours, 2.5 hours he spent directing the various ministries. So now they have started 40 new medical colleges last year. This year they're starting a few more medical colleges. They started 100 nursing colleges, and they increased the nursing students from 70 to 300 per college. So to meet that global Indian shortage, global shortage. So I think he's acting. And only thing is, on here in India, one more thing, next time I meet, I want to see that if they can give visa on arrival. It's today about $60-70 billion industry to health tourism. It is going to grow to at least 200 billion in the next 2 decades. So India will be, today we are getting a small percentage. We can get a significant amount of that foreign exchange. More than that, you'll be able to give honorary good jobs for people. Employment, good employment for our people, doctors, nurses, paramedics, who are proud to what they are doing, apart from improving their living standards.
Oh, fantastic. A great suggestion of visa on arrival.
And we are sending people abroad. And they will not only live happily, they will support their families back home. And Government of India gets remittances. So in all of this, I think he has done whatever he is doing. For example, Operation Sindoor is something which is very creditable. Took a strong stand. He didn't, want to bend. It's not his bending. He didn't want India to bend. So that is what I admire him.
Fantastic, Dr. Prathap Reddy ji. Thank you so much.
Thank you.
What an amazing conversation. It's just been amazing. I look forward to the next one very, very soon.